Your neck tells the truth long before you notice it. The shoulders creep up a centimeter, the head drifts forward a couple more, and by evening there's a dull band of pressure behind the eyes. Try a quick check right now. Glide your chin straight back as if making a tiny double chin. No tilting up or down. If you feel a gentle tug at the base of the skull or it's oddly hard to control, that's your body pointing at the real pattern behind most neck and shoulder pain. We tend to blame whatever's closest: cold air from the window, last night's pillow, the heavy bag, the marathon meeting. Those can irritate, but the deeper story is mechanical and very human. Screens sit low, hands reach forward, the chest tightens, and the muscles that should anchor your shoulder blades get quiet. Clinicians often call this the upper crossed pattern with forward head posture and a misbehaving shoulder blade. In plain language, the front is tight, the stabilizers are sleepy, and the big surface muscles in your neck do far too much for far too long. Joints complain, nerves get noisy, and even small stress nudges the whole system toward ache. Physics makes this simple. Your head is heavy. The farther it moves in front of your torso, the more your neck must pull to keep it there. Muscles designed for bursts become emergency staff working double shifts. Add stress breathing high in the chest and the neck joins in to help your lungs. The result is a loop you already know. Stiffness on waking, a midday throb near the base of the skull, a late-day knot at the top of the shoulder that no massage seems to erase for more than a few hours. Let's prove the pattern with two tiny experiments. Stand where you are and raise both arms slowly overhead. If one shoulder blade wings off your ribs like a small fin, or you hear clicking, the blade isn't gliding well. Now turn your head left and right. Remember which side feels tighter. After a 1-minute routine in a moment, repeat the turn. That change, often immediate, is your live scan. Quick safety note before we move. If you have severe arm weakness, constant numbness that doesn't change with position, balance trouble, fever, unexplained weight loss, or pain after a fall or crash, see a clinician. If your grip is failing or pain shoots sharply down the arm with neck movement, get checked. For the typical desk and phone pattern without those signs, movement is not only safe, it's medicine. Win your first minute. One hand on belly, one on chest. Inhale through your nose until the belly rises first. Exhale softly through pursed lips. 2 breaths like that. Let the shoulders drop. Now do 3 gentle chin tucks. Glide the chin back for a 3 count. Release for 2. Finish with 2 small shoulder blade sets. Imagine sliding the blade tips into your back pockets, down and in. Hold 2 seconds. Release. That's 60 seconds. Most people feel the neck lighten a notch right there. Add a little space to the front. Step into a doorway with your forearm on the frame, elbow at shoulder height. Lean forward for 15 seconds to open the chest. Switch sides. For the side of the neck, tip your right ear toward your right shoulder, just until you feel a friendly stretch on the left. 10 seconds, then switch. Stretches should feel like, ah, never like, ouch. If you have a warm pack, park it across the top of the shoulders for 2 minutes tonight. These moves don't rewrite the pattern. They quiet the noise so the reset sticks. Now the reset that changes the story. Sit or stand a little taller, as if a string lifts the crown of your head. Glide the chin straight back without lifting or dropping it. 3 seconds on, 2 off, 10 times. You're looking for a soft stretch at the skull base and a subtle effort deep under the jawline. Pair this with 10 shoulder blade sets. Small, precise, no proud chest pose. The goal isn't a dramatic posture. It's teaching your blades where home is so they glide when your arms move. Strength makes relief last. If you have a light resistance band, anchor it around belly button height. Keep your neck long, chin gently tucked, and row the band toward you with elbows close to your sides. Feel the blades glide down and back together, then return slowly. 2 sets of 12 with an easy, steady tempo. Add a face pull variation when ready. Elbows a bit higher, pull toward the cheekbones, ribs quiet, no shrugging. Then wake up the deep neck stabilizers with isometrics. Palm to forehead, gently press your head into your hand for 5 seconds without moving. Release, repeat twice. Do the same pressing into the right and left hand at your temples. Think whisper to the system, not shout with force. Your brain loves checkpoints. In the first 30 seconds, you shifted breathing down to the diaphragm so the neck stopped helping your lungs. In the first minute, you eased tightness. In the next 10 minutes, you installed a mini routine that protects you while you work. In 3 days, you should sit a little longer before the ache returns. In 7 days, you should turn your head more easily when backing the car, and any neck-triggered headaches should show up less often and leave faster. Make your environment carry some of the load. If you use a laptop, raise the screen to eye level, stand, stack of books, anything stable, and use a separate keyboard and mouse so your shoulders don't hike up. Keep the keyboard close enough that your elbows rest near 90 degrees. If your day is phone-heavy, lift the phone to your eyes instead of your eyes to the phone. Try a 28-2 rhythm. 20 minutes focused sitting, 8 minutes standing or light moving, 2 minutes of the Relief Mini. If that's too much, do 30-second micro resets on the half hour. 5 chin tucks, 5 blade sets, 1 calm breath. Small and often beats big and rare. Sleep quietly shapes your neck. On your side, a pillow should fill the space between ear and mattress so the neck stays level. On your back, a thinner pillow or one with a gentle neck roll works best. Stomach sleeping twists your neck for hours. Too expensive for a cranky neck. If mornings are stiff, do 5 chin tucks before you get up, then 5 blade sets while the kettle warms or the coffee brews. That's less than a minute, and it sets your baseline before the day builds tension. Stress blends into this whether you invite it or not. On busy days, breathing climbs into the chest, the jaw clenches, and the shoulders inch up so slowly you don't notice until the headache arrives. Use a quick 4x4 box breath. Inhale for 4, hold for 4, exhale for 4, hold for 4. 4 rounds. It's not about chasing Zen. It's about telling your nervous system there's no emergency so your neck can stop helping your breath. Here's a simple 7-day map. Day 1 and 2. The 1-minute drill 2 or 3 times plus doorway chest openers twice. And learn the chin tuck. 10 gentle reps. Day 3. Keep everything and add 2 sets of 12 band rows. Day 4. Add 2 rounds of 5-second neck isometrics in 3 directions. Day 5 through 7. Maintain the lot and perform the micro reset 3 times during work blocks. Track 3 signals. How far you can turn to check the blind spot. How long you can sit comfortably. How often a neck-triggered headache visits. If any of those improve, even a little, you're on the right track. A few don'ts protect your gains. Don't stretch into sharp pain. The neck rewards almost easy ranges repeated often. Don't chase cracks and pops as the whole plan. Pleasant, but temporary if the pattern stays. Don't load heavy shrugs or upright rows while the traps are already on overtime. Don't ignore numbness or weakness running down the arm. Push pause and get checked if that shows up. If you like the gym, keep it. For 2 weeks, keep overhead work light, pull more than you push, and prioritize rows where your neck stays long, ribs quiet, and blades glide. Quality beats quantity. If your job is physical, hide the micro resets in your transitions, before a lift, after setting a load down, as a break starts. 10 seconds here and there is how you win the day. People often ask about scans. For everyday neck and shoulder pain that improves with movement and changes with posture, imaging rarely changes the plan. It often shows normal age-related wrinkles on the inside, disc bulges and degenerative notes that sound scary but don't explain your symptoms. What does change the plan are red flags, a big trauma, or zero progress after a fair try. Otherwise, your best scan is the way your body behaves after a week of consistent resets. Let's set 2 invisible anchors that make good posture automatic. First anchor, loading screens. Anytime an app spins, do a 10-second sequence. Gentle chin back, blades down and in, 1 calm nose inhale, long mouth exhale. Second anchor, doorways. Every time you pass through one at home or work, do a tiny blade set as you walk. Nobody notices, your nervous system does. Within days, these become default behaviors you don't have to remember. Rerun our first experiments. Turn your head left and right. Compare to the beginning. Raise your arms and watch the shoulder blades. If the arc feels smoother or the blades glide with less drama, you've already nudged the system in the right direction. That proof matters more than any explanation. Your body is plastic, and it's listening. Expect gradual, stubbornly real change. The knot at the top of the shoulder visits less often. The end-of-day pressure behind the eyes softens. Reversing the car takes less neck negotiating. Every win buys you momentum. Miss a session? Nothing breaks. Do the next one. This is more like brushing your teeth than running a marathon. Short, regular, and boring in the very best way. There is one quiet trick that often unlocks everything in under a minute. Sit tall, glide your chin back, and place your fingertips on the collarbones. As you exhale, imagine your sternum floating slightly up and away from your navel, while the shoulder blades melt toward those back pocket points. Hold that shape for 3 slow nose breaths that expand the lower ribs sideways, not upward. On the third exhale, rotate your head gently left, then right. Most people feel an immediate smoothing of the turn. That's not magic. It's your breath telling your neck it can stop acting like a second set of lungs and your blades finding home. You came looking for the number one cause, and it isn't a mystery injury stalking you. It's a repeated position training the wrong muscles to do the wrong job all day. The fix isn't heroic either. It's minutes, not hours. It's tiny resets layered into life you already live, strength in ranges you can control, and environments that stop fighting you. And here's the twist. You don't need extra time. Trade only the moments you already lose to waiting. Loading wheels, elevators, coffee lines, for one breath, one chin tuck, one blade set. If your neck just felt a little lighter reading that, you've already started.